Hello?
We can hear you, Annie.
Okay. All right. We're ready to begin. Let's begin. On behalf of Pathfinder International and the What to Expect project, a very warm welcome to each and all of you from every part of the world you're joining us to today's discussion on climate change and maternal health, where we go from here. This is a very timely discussion and a very incredible and very important conversation with amazing speakers, especially in the lead up to the 27th conference of the parties to the United Nations Framework Convention on Climate Change, also known as COP27, that opens up this Sunday in Egypt. More than 500 people registered for today's event, which shows not only the urgency of this conversation, but the strong solidarity of the global health community around this critical issue. My name is Annie Toro, and I serve as President and Executive Director of the What to Expect Project, a nonprofit organization dedicated to educating, supporting, and empowering at-risk moms in the United States and around the globe so they can expect healthier pregnancies, safer deliveries, healthier babies, and healthier futures. Our organization's work and priorities are centered on providing expectant and new moms with the information they need to safely navigate pregnancy, postpartum, and beyond, focusing on a continuum of care. Climate change is one of the largest global threats to public health, and specifically to maternal health. The effects can be direct or indirect through heat stress, extreme weather events, and air pollution, impacted both the immediate and long-term health of pregnant women and newborns. Exposure to extreme heat can lead to kidney failure in pregnant women and has been associated with low birth weight, preterm birth, and infant mortality. Prenatal exposure to air pollutants can increase the risk of preterm birth, low birth weight, and stillbirth. And air pollution is also associated with heart defects, autism, and neurodevelopmental delays. And we know that extreme weather can severely disrupt maternal health systems, from closures to infrastructure and more, and affect food supplies through the effects of droughts, flooding, and forced displacement. But while evidence of the intersectionality between climate and health has generated some discussion, there's still little action taken to safeguard maternal health. There's also little guidance on how pregnant women can prepare for climate emergencies, such as extreme heat. It's important to emphasize that climate-related disasters do not just affect one sector. The climate crisis is linked to many harmful outcomes around the globe: gender-based violence and sexual violence, mental health problems, economic instability, disease outbreaks, food insecurity, inadequate housing, lack of transportation, unsafe roads, malnutrition, displaced populations, increased risk of non-communicable diseases, lack of safe water, poor sanitation and hygiene conditions, inability to access basic health services, and more. Everyone here today has either been personally affected by climate change, either directly or indirectly. When Hurricane Maria hit the Caribbean in September of 2017, I was in New York for the UN General Assembly and couldn't reach my family for almost 3 weeks. My hometown hasn't been the same since then, compounded by earthquakes at the end of 2019 and 2020, something I never experienced as a child growing up in the Caribbean. Then the pandemic and Hurricane Fiona less than 2 months ago. How have climate-related disasters affected you and your loved ones? It's a question that I want to leave you with as I move on to introducing this amazing panel of speakers and getting this dialogue going. So with that, I would like to give the floor to this distinguished group of panelists that I'm really glad and honored to be associated with, leaders in maternal health and climate issues. To start a conversation, I invite you to introduce yourself and to please tell us one thing about how climate change is impacting your work and how it's impacting you and your country or the country that you live in. We will start with Angela Nguku, then Elizabeth Pleuss, and then with Tabinda Sarosh. As we begin our panel discussion, a quick reminder that we will be doing a Q&A session following the conversation with our panelists. So if you have a question for a specific speaker, please type it in the Zoom chat. With that, I'll turn it over to my speakers for a brief introduction.
Hello, everyone, and really delighted to be here. My name is Angela Nguku, a graduate midwife by profession, and a thought leader and a champion and advocate, self-turned advocate, really, because of the issues that I saw around maternal newborn health and the attention that it was not being given. And so I decided to leave my career of practice, education, research to really become that person who raises visibility and profile. And I'm glad to be joining so many experts today to speak about this issue of climate change that has been given a raw deal for mothers and their newborns. I speak today from a country that is currently stricken by drought, Kenya, at the moment, and the most affected people are women and girls. We've had to change our programming to really focus on feeding the women and their children. And to me, that's an issue that gets me really energized to keep speaking and speak today to you about what I've seen and what can be done around this issue. Thank you, and back to you, Annie.
I'll turn it over now to Elizabeth.
Yes, thank you very much. Hello, everyone. My name is Elizabeth Pleuss. I'm the Deputy Division Chief for Maternal and Newborn Health in the Global Health Bureau of the U.S. Agency for International Development. Very pleased to join you all today. And one of the key things that we see in our work, we work on both development and also humanitarian assistance, is that the crises impacting the populations we work with are coming more frequently and often one after another, cascading on compounding events. And this makes all aspects of our work more difficult and puts those who are most vulnerable at even higher risk from climate change impacts. That, I'll hand it back over.
And Tabinda?
Hello, everybody. Good morning, good afternoon, and good evening, wherever you are. It's such an honor to be on this panel and raising the issue of maternal health and reproductive health and rights and their intersections with climate change, together with all of you. I'm Tabinda Sarosh, and I'm the president for Pathfinder for the region of South Asia, Middle East, and North Africa. Climate change has been affecting my region for a long time. Bangladesh and Pakistan are actually among the top 10 countries that will be affected by climate change. I'm based out of Karachi, and this year, related to climate change, Pakistan faced one of the worst floods in its history. The rainfall average was 750 times the average amount that it usually is, resulting in urban floods in cities like Karachi and Peshawar, but then widespread flooding in the rural areas, which already have a very delicate and fragile health system. Together with all of you, I want to seek solutions. Thank you.
Thank you. Thank you, all of you, for these remarks and for your introduction. As you can all see, we have an incredible group of panel and experts here who will be able to dig in to very complex issues and have an array of experience across different countries and continents and issue areas. I'm excited to be working with you as a partner in these efforts and associated with you as we work together on these issues. We clearly know from just the comments that Tabinda was just mentioning, the unprecedented floods in Pakistan and how they're expected to be felt for years. And some of the things that we all and all the participants have probably been keeping up with. About 1,500 health centers have been damaged, 2 million acres of crops impacted and killed more than almost 800,000 heads of livestock across the country. That's not to include what's happening in Nigeria and so many other countries. We pay our respects also to the countries, to all these countries who are our friends, our partners, and our family in this global health community. So thank you again for that. And I'm just gonna dig into going into the panel discussion, and I'm gonna be asking very specific questions to our panelists, and what almost like a fire chat kind of a style. We have a lot of room to cover and a lot of important things to cover. So I'm going to start with Tabinda with this question. Reflecting on climate disasters that have occurred across the world in 2022, including the ongoing COVID-19 pandemic. Can you please comment on the interruption of maternal, newborn, and child health services, which for all of you who are in this webinar, I will be often probably referred to as MNNCH, and its long-term potential impact on reproductive health? What lessons do we need to draw from recent disasters to be better prepared? Thank you, Tabinda.
Thank you so much, Annie. And thank you also for reminding us that we are still facing the pandemic. 2 years ago, in 2020, when the pandemic had started, we had seen cessation of critical maternal health services and reproductive health services to women and girls. Many of the countries that we work in saw discontinuity of services, discontinuity in outreach to women. And this was very important in our context, where women and girls already have lower mobility and lower access to health services. Already fragile health systems were very quickly overwhelmed. And then at the top of that, we saw climate-related disasters happen in many countries, which further strained the health systems. And for us, what an important lesson that came out of it was that these things are going to be a part of our life. We do not need to wait for the next big crisis to happen. Disruptions will continue to occur. And right now, the need of the time is health resilience, building health resilience. I referred to the flood disaster in Pakistan earlier. 33 million women, 33 million people have been affected by this. And 650,000 out of them are pregnant women. And around 73,000 women are expected to deliver in September. Were expected to deliver in September, and most of them were without skilled birth attendants because they were in a camp setting, having been displaced from their houses. Newborn care also became a big challenge. In addition to that, family planning services, which were much needed at that time, also came to a halt. According to an estimate, 1,600 to 2,000 health facilities have been damaged. In countries like Bangladesh, where cyclones are a regular feature, the intensity is becoming huger and huger. Around 50% of deliveries in Bangladesh take place at home. When cyclones hit and women and girls have to go into shelter for days, they find it difficult to find a health facility. Girls remain without menstrual hygiene supplies for days. In addition, women and girls are also at an increased risk of gender-based violence. Almost 1 million houses have been now damaged by the floods in Pakistan, and these women and girls remain without protection and shelter. Pathfinder's work in Bangladesh and in Pakistan has been around providing support to the women through multi-sectoral approaches, reflecting on the needs on ground and building contextual and evidence-based response strategy. Right now, our team is at is in Egypt preparing for COP27. In Egypt, we are working with the government to create green clinics, which build longer-term resilience of the health systems to endure climate change and its effects, and to ensure that continuity of the services to women and girls is not disrupted. Thank you so much.
Thank you. I mean, it's hard to put into words, what this means, what it can mean, and I think that when all of us just having friends in these countries, but also thinking about the coincidence of life, like I like to think about on a regular basis. Who can promise us that we're born in a place that we're born, and so I guess that's my way of approaching the work I do. That could be us, that could be our sister, that could be a mom, that could be a child. And we appreciate the work that you're doing on the ground, and just to seeing how you really are activating and focusing on helping those that are the most vulnerable, and being able to make sure that they have shelter, that they're protected, and having that broader perspective, given the experience of the organization in handling all these issues for so many years, that you know how to respond, and please know that we and I speak for all of us who are not only part of this discussion, but also those who are participating, that we would love to be able to be part of the efforts, and join you in any way we possibly can. Thank you. I'm going to turn it over now to ask Elizabeth about what are some of the key recommendations from your work that would encourage communities and health systems to work with an integrated multi-sectoral approach to improve preparedness and planning.
Sure, thank you. And thank you to Tabinda. We just heard, sharing about the devastating impacts that the flooding in Pakistan is having, as well as other disasters have, and especially the disproportionate impacts on women and girls. And response efforts are critical, but earlier action before the extreme event happens is also needed. And we've seen that multi-sectoral collaboration is key to climate adaptation and disaster preparedness in general. And the need for this will only increase. We know in the last 2 decades, the number of cyclones, floods, droughts, and other climate-related disasters has doubled, with a cost of over $2 trillion. And they will continue to increase as temperatures keep climbing. And we know that the impacts are equitably experienced. Climate change hits women and children and poor marginalized communities first and worst. And this is part of why President Biden launched the President's Emergency Plan for Adaptation and Resilience, known as PREPARE, last year at the UN Climate Conference, COP26 in Glasgow. And PREPARE brings together the diplomatic development and technical expertise of the US to achieve a bold goal by 2030. And that is to support more than 500 million people in developing countries to adapt to and manage the impacts of climate change. Recently, the White House released an action plan that outlines specific steps the US will take to achieve this goal. And all of them involve multi-sectoral collaboration. For example, 1/3 of the global population doesn't currently have access to early warning and climate information services, make informed decisions about how to address the risks posed by changing climate. So we'll work with partners across sectors to strengthen climate information services and early warning systems. And this is aligned with the UN Secretary General's call to ensure early warning for all by 2027. This will support efforts to include monitoring and warnings for droughts, floods, air and water quality, extreme heat, and other climate impacts, so we can get information to the people who need it. And we know that these early warning systems are most effective when they are well connected to health systems and to the communities most in need. So by bringing together Earth observation capabilities, weather forecasters, disaster risk specialists, emergency responders, and health systems, we aim to combine the benefits of those various areas of expertise and translate them into actions that will save the lives of those at greatest risk to extreme weather events, including pregnant women, newborns, and young children.
This is terrific. It's so nice to hear, Elizabeth, about this comprehensive approach to tackling these issues, and thank you for giving us that background in everything that's been happening with the administration and the concerted efforts that all of you under your leadership and the leadership of USAID and how that, I mean, the years of experience of the agency, and the work that it does, the commitment of it, of all its workers who, we all had the pleasure of working with and partnering for so many years, exemplify, what it is to be, what we like to see in government officials, and being able to be truly dedicated to serve those who need it most, when they're needed most. So this was really, really great. And it was also very informative to hear about the engagement with the UN Secretary General and how those connections are, working in tandem. That's very, very helpful and informative. Thank you so very much. So now I'm going to go back to Angela. And if you could please share with us some or any best practices that you think could demonstrate the need for women leadership in climate change resiliency efforts.
Thank you so much, Annie. This is a topic that first, I feel like it's very dear to my heart. And the thing is, because the issue we are discussing about climate change and the impact of climate change on maternal health is sad, because those affected most by the same are the ones who contribute the least to climate change. And also, they're the ones that are at the rock bottom when it comes to decision making. Mm-hmm. It's a gendered issue, whether we like it or not. And as such, women and girls and their babies are the least consulted when it comes to decision making around the issues that impact them. I'm speaking from experience. I work for White Ribbon Alliance as the Deputy CEO, and I'm also the founder of White Ribbon Alliance in Kenya. And a few years ago, we did do a campaign to understand the whole aspect of quality and what it means to women and girls, especially what does quality reproductive health care mean to you as a woman and a girl. I'm linking this to what you've asked me because I want to showcase why it's important to really consult the wearer of the shoe, because she knows best where it pinches most. And we went to these experts. I call them experts because in every space that I speak in, I tell everybody, including you and me, that the real experts are the people who have the lived realities and experiences of the issues that we are discussing. Today, we are talking about maternal health. Who is pregnant and that baby who is born in that space, in that drought, in that COVID pandemic, in that flooded place in Pakistan, in that place where there are wildfires, is the one who knows best what could be the priorities and the decisions that need to, and solutions that need to be addressed. And as such, we went further to different women from different spaces to ask them, what does quality reproductive health care mean to you? And some of them came out and we were shocked because we are giving them a platform to actually realize that they had what it takes to decide and prioritize what that means. And as such, as we are talking about climate and maternal health, I think as much as we are thinking about COP27, other spaces where all this needs to happen, the people who should be in those spaces are the people affected. But let me bring you back. Climate change is a gendered issue. Women and their babies are the most affected by natural disasters. The COVID pandemic showcased that the most affected, whose money was taken away and resources was taken away and reallocated, it is maternal newborn health, sexual reproductive health, and the same in different spaces. Who was missing in those task forces? It is women and their newborns and girls. Why? Because they are women. And for me, as we are thinking about solutions to address these disasters, all these issues, the impacts of climate change, we cannot talk about them until we can be able to go back and listen to those most affected. A lot of times we assume we know the solutions, but believe you me, I'm saying this because I have worked a full circle as a practitioner midwife, as an educator, as a researcher. And then I decided, let me become a campaigner and an advocate because I realized I did not have the solutions. And so bringing those voices to the front lines and talking about climate change and its intersectionalities in wholesomely will really help address the issues. And there are so many spaces and places to showcase that that is possible. I sit in a task force, the task force on climate change for African feminists. And some of the demands that I've had, simple questions, simple answers, the demands that we actually are pushed forward for COP27 to the different governments that are coming to that event. I think need to be taken into consideration, that I could share the link here to showcase why it's important that we cannot not remove we need to take back the rights and entitlements that we've taken back away from women and girls, and let them decide and lead the decision making and the solutions that we are finding. Without that, I think we'll still be doing the same, talking to ourselves for the longest time, and at the end of the day, expecting to really impact and bring about change. Why I say that is because as a woman born in Africa and living in Africa, I have realized that we, women and girls, and especially from this part of the world, the majority world, are born with power. It's a lot of times it's a society, whether within my society or the global society, that decides that these women have no power and rights. And so we need to give them what it takes to do that. We are born with power, and we have what it takes to actually bring about the change. And so it is us to decide as we go forward what needs to be done, is actually put the woman back to the center. The wearer of the shoe, again, I'll say, is the one who knows where it pinches most. Until we do that, it will just be the same cycle of talking to ourselves, coming up with the same solutions that are not impacting anyone. Thank you so much. Back to you, Annie.
I can't follow that. This is the kind of conversations that not only thrive, and move every inch of what I am built with and off, and I'm sure every single person who's joining this webinar feels the same way. Not only about your advocacy, Angela, and your commitment, but how you've even turned the work that you've done in looking at, this is where I'm needed the most. And you're thinking about it from a perspective of a midwife, and then thinking, well, I need to move in here and be an advocate. I need to know, just that shows your commitment and understanding of this on the ground. And it's really interesting. You've mentioned some points here that we've talked about so much. We feel like broken records, talking about how in every single emergency, women and girls are the ones that have to pay the consequences of everything. That any advance that we do on maternal health, and we end up going back to who knows how many years past. Why is it that after all that progress, it stays the same, or goes back to, we saw that in Ebola. It was so clear what happened after the progress we had made, and so we're really grateful for these comments. And what I'm gathering from this is please tell me, correct me if I'm wrong, but there's a sense also of thinking about some of these issues from a rights-based approach, as seemingly something critical here, to empower and give opportunities to women through training, education, and other tools to gain economic autonomy. However, and this is the catch-22 that I find with some of these issues. And please, feel free if you want to say something else to this comment, because I think it's a really important one that everyone will be, could gain to learn a lot of. That even though we want to do that, however, there are also all these practical issues that may get in the way of that. So we can say, this is what we need, and women are the first ones to say, I want to, gain more education, training, being able to read, write. But then on the other hand, she has to be the one who has to walk a full day to get water. She has to be the one that has to be taking care of children. At the same time, she doesn't have anybody else, or taking or being the primary caregiver, especially during emergencies. And so everything falls on women, and we all know that. And so at the same time that we want, if a woman chooses, let's say, literacy, but if she needs to then engage in all these different tasks that are not going to allow her to be able to have that autonomy and have that time for that training, that's going to get in the way. So what can we do? We have to think about these potential barriers and how to mitigate these issues That's also an important thing. And clearly, you know, you can see I get very excited about this, but I, you know, I wanted to mention that to you because it's something that I see on a regular basis when I'm in the field, and I see this eagerness, like it's just the thirst for wanting to be there, to learn, to gain the skills, whatever needed to make a difference and have that economic autonomy as well. That's going to let them, we all know how women drive societies. But then there are all these other barriers. Is there anything that you might like to add on that, on maybe before we move on?
Thank you so much. I'm so glad you brought the last point, because I think from my pointers, what I said is that we cannot address this issue as in one way. It cannot be a vertical address. We can't address it vertically. For the longest time, we have siloed women. And we are talking about this one woman who's supposed to be taking care of the household, who's supposed to be going to the health facility to take their baby. God knows why the clinics are only opened from one time to the other. Yes, we should be opening the clinics around the times when the women are available. She's the same one who's supposed to go to school, take care of her household, and so much more. And so for me, to address your point and to respond to your point, we must look at the different multi-sectoral approach and the intersectionalities that come in, and look at and stop the competition and collaborate to address the issues that we are talking about. We are actually some of the perpetrators and the perpetrators of the issues that we are talking about. I say that because we all want to take a beat from that woman and say, oh, look here, cameras, I did this for this woman, and so I'm so the one. Instead of looking at it as this one woman that we're supposed to be collaborating to address. So it's no longer about the woman. And that's why I said, until we send out this woman, we'll not get there. We need to come together and co-create solutions with that woman from an intersectional point of view, multi-sectors point of view, and address also so many other things that you've talked about. One of the things I've heard you talk about is the unpaid care work. The COVID pandemic showcased and brought so much light around why unpaid care work is an issue, and it drives economies, and we must think of how we are going to address that. We talked about sexual gender-based violence. A lot of that has come up. The climatic changes have also done that a lot. We also talked about the siloed approaches around addressing the climate change and maternal health. Believe you me, if we continue doing business as usual again, we are going nowhere. So we must first take a pause, push back, and ask ourselves, where are we going wrong? Honestly speaking, I feel like there's so much money that has been that has been put in this space. We need to be able to come together and ask ourselves, how do we need to redo this so that at the end of the day, we can be able to achieve greater outcomes with the little of the much that we have. I always feel like there's enough. It's only that it's poorly distributed, used for the wrong reasons. Like now we are talking about COP27. I'm sure there's so much money that is going to be spent on air. In fact, we'll be even doing so much pollution, much more. We'll be contributing a lot. But who is going to be missing on those tables? The same women we are supposed to be talking about. I wish we use that part of that money to actually address the gaps that we're having now. I think there'll be so much more that we'll do. But until we continue doing business as usual in our well-ventilated boardrooms, expecting changes in the places where we were just doing a big disservice to ourselves and to the women and girls and their babies that we're supposed to be serving.
Completely.
Back to you,
I
Annie.
so appreciate it. So appreciate it. Thank you for responding to that and digging deeper into that very important issue. I know that I'm not the only one here. I can speak on behalf of everyone to say how important this real point brings it home, and that is home wherever everybody who's here and part of this webinar and what that means to them. So thank you for those contributions. I think that it's going to spark a lot more engagement, not only after this, but we have our commitment and that we will join in this collaboration, in this fight to make that happen. So I'm going to turn it over to Angela. To where am I? Okay. So we're going to Angela, I think, right? No? Am I? Tabinda. I'm going to Tabinda. Sorry. Okay. So in terms of what opportunities can be ongoing what opportunities can the ongoing climate change crisis, as you can see, I got very excited with our last question, as I've been getting with all of them, but this really moved me in different ways. So coming back to Tabinda again, what opportunities can the ongoing climate change crisis provide the global health community to advocate for just and equitable integration of MNCH into the health and climate responses, including consideration for the multiple roles that women play in families and communities as a whole? Did I already ask this question and I just got kind of thrown off by or have I not asked this question?
Thank you, Annie. Just the right question at the right moment.
Great. Okay, perfect. I am so excited that sometimes, and this is what happens when you have all of these women who are really excited about talking and wanting to make a difference. So thank you. And sorry that I'm, starting a bit later than I had anticipated for this question, Tabinda.
Thank you. Thank you so much for your passion. I think passion is something we must not let go of as we go into this. And also, Angela, thank you so much for bringing up the gendered issues that we are going to face in climate change and about opportunities. Indeed, every dark cloud does have a silver lining, but I worry that this cloud is particularly very dark. And we have already started seeing the repercussions. Elizabeth is on the call, and Elizabeth, you might remember Pathfinder was one of the first organizations that started PhD programming in Africa around Lake Victoria. And this was more than 15 years ago when we were talking about population, health, and environment together, exactly with the three components of access of women to maternal and reproductive health. Secondly, women and communities access and control over their resources and leadership development. As we move forward, more and more, it's important for women leadership to grow out of this. So where are the opportunities? Let's look at some of the grim things also side by side. Estimates from WHO and UNICEF paint a grim picture of immunization services uptake as well, which have been declining since 2019 related to the pandemic, and now might get worse due to the deterioration of the health systems impacted by the climate change. It can be assumed that the indicators for MNCH across the board will also see a steady decline, and it might backtrack any progress that has been recently made. Decline in service uptake does not indicate a lack of need for these services. Women and girls will continue to need these services even more so in the coming future, due to resource insecurity that would make pregnancy and child health even more vulnerable. We know that extreme heat conditions affect pregnancy. Food and water insecurity is already on the rise. As Angela just mentioned about Kenya, Pakistan is also a geography which at one hand faces floods and on the other, in other areas, droughts. And this directly affects reproductive health and its outcomes. The near future demands for us to take concentrated and conscientious efforts to advocate for the integration of MNCH into health and climate responses, to encourage women and communities to work together to improve women and girls' health as a means of combating climate impact. This would mean changing policies and programs to be gender responsive and gender transformative, to ensure climate resilience is part of health systems strengthening and resilience, and for the movers and shakers to come together for fulfillment of commitments across the board. And hence, I'm very happy to be in this run-up event for the COP27. I hope that powers that be are listening to us. States need to learn and invest into health systems, and this is an opportunity for stakeholders to advocate for an increase in climate and health financing and investment into MNCH service delivery to ensure we are reaching the most marginalized, most vulnerable, despite the climate conditions. Thank you so much.
Thank you. I mean, there's just so much to unpack here, and it follows so nicely from Angela's comments, in terms of women in control and in leadership positions, but also you mentioned this issue of of the ramifications that we've seen from what's happened, with the pandemic, that we cannot forget, because we're tackling all these issues and all these emergencies that are going by the day. And we all have the numbers. I mean, we can quote them here about, we don't do anything, it's expected to be like 7,000 disasters. By 2030 there will be like the equivalent of 1.5 a day. By 2030, I think are the numbers that I was reading, just last night, over 600 and something. It's just the what's expected. It's so horrific, but also it's where we're coming from. We're coming from already systems that are completely suffocated by the challenges that are happening in these countries, from the pandemic, from other disasters, from other emergencies, from protracted crises that have been ongoing in some of these countries, and then the sudden onset, right? That we know with climate change, but we can't just separate those two in some ways, because with continuous conflict, that one leads to the other. Then there's the displaced populations, and women not being able to have services to even the most basic things like family planning. And what does that mean? More unintended pregnancies, if women not being able to take kids to take their immunizations, and getting access to basic services to their health when they're pregnant. What does that mean for them? And so I think that your points here are so incredible, and how they they've been in the backtrack, and doesn't meet they're just behind. And who is it affected? More vulnerable, issues of water insecurity, in the integration issue. I loved hearing that too, because that's just kind of how my brain operates, that we all work together, and we can't separate the way that we operate. And that's been a big thing for the work that I've done for over 2 decades, about integration, that we're not in competition, that we can't these issues cannot be looked upon in isolation, because we're not just about one thing. We're not just about health, we're about food, we're about being able to get to an appointment, we have our families to take care of, where do we live, how do we get to appointments, and all these different things. And then just climate change and issues of how the transformative in investing in health systems and financing. Those were really, really important issues that will be very salient, especially as we prepare and really are spoken about the needs for leaders to consider as they are going into COP27, and that's what we have to be very vocal on. So thank you again, Tabinda, for these incredible comments. So I'm going to turn it over to Angela again about the theme of this year's United Nations General Assembly was climate change, food insecurity, humanitarian needs, and worsening inequalities. Do you feel like there was sufficient attention given to maternal or reproductive health within this complex overlapping crises?
Well, I feel like I've answered you that question, because I feel like a lot of times maternal newborn health is always an afterthought. And even when there is a mention, I never see the commitment and the follow through. And I say that because as much as there's the linkage between climate change and health, I feel health is broad. And so there's need to have that specific focus on the most affected: pregnant women, women with small babies, children, and the like. And so I can say I don't feel it was given the justice that it deserves. And even when in spaces where it is given or there's a mention, I feel it's lip service a lot of times. And I wish you can see more investments and more walking the talk. And actually, not just that, the investments that seek to address different aspects and seek to look at different players, whether it is governments, practitioners, partners, donors, organization, the development space, other global stakeholders and other local stakeholders towards climate change, addressing climate change impacts in maternal newborn health. I feel like there's so much that needs to be invested around increasing understanding and awareness on the impact of climate change on maternal newborn health. I don't feel like there's enough around that. That has been the investments around that. I don't feel like even the prioritization. I feel a lot of times the prioritization, there's a lump, we lump countries together like they are homogeneous. We lump populations together that like they're homogeneous. Believe you me, climate change affects refugees differently. It affects migrants differently. It affects the average population differently. And so I think there needs to be the way of prioritization in terms of how the investments are going to be done. More to that, I think we always talk about climate change and the impacts and the planning around it, and then leave it there until it happens. Can we see more concerted efforts? Because this has been happening and it's going to continue happening. I would wish to see, even as the different global stakeholders, the different players who are really doing this and ensuring there's resourcing and all that, really look at it holistically and prepare, including ensuring that we know. And by the way, there's a lot of iniquity in the same. I've just earlier told you about the drought issues in my country. There's been a lot of flooding in Pakistan. We've heard of different spaces of different issues about climate issues. But I feel like even when you open the news, when you go to watch the news, you feel like even the media, the different media, the international, the local media, how it's given internationally and how it's depicted is different. If this was to happen in different places, there's all over the place. I actually don't live in a country where we have what are they called? Typhoons and hurricanes and the like. But I hear it more than I hear people droughts or floods in Pakistan or other places. I'm talking about the recent ones. So I think we need to have equity in addressing this issue. As much as we are talking equity and in addressing the issue as linked to maternal newborn health, even equity in terms of how we talk about it, there's no better human being. And so we need to decolonize even the way we are looking at it and addressing it as we go forward. Because I feel a lot of it, even the funding around and research on the different aspects of the connection between climate change and maternal health, we need to have that equitably done. I always feel like even when it comes to educating climate actors and authorities on with adaptation and all this, we need equity around how do we do that, and dig deeper even to maternal newborn health, because it's really a big deal. It's a real problem that needs to be addressed. Back to you, Anne.
Terrific. I'm looking at the clock, and I have to. There's so much that I want to say about all these topics, and I find that I have to control myself because this is so invigorating. It's speaking to the deepest issues that make me wake up in the morning with excitement about the work I do, and for those who really need it, and to be surrounded by all of you is just really sparking this, and just I'm full of energy to do what's next. And everything you've mentioned here, it's just so on point and so relevant. And I wish I could just go on and on about the points that you've mentioned, because we really do need to walk the talk. The players, the donors, the organizations, the local stakeholders, not forgetting anybody. And the sense of talking but no follow through, it's so important. So thank you again for these remarks. So in the interest of time, I'm just going to move to Elizabeth. I have another question for you. What about advice do you have for working with policymakers at the local, state, national, regional, and global level in addressing the consequences and impacts for short and long term of these issues on MNCH and climate change?
Sure, thank you for that. I suppose I would share two pieces of advice, and one is really reiterating a lot of what Angela was addressing earlier and now, that is to work in coalitions, multi-sectoral coalitions. Although many of us here are joining today because of our dedication to maternal health, adapting to climate change isn't just a maternal health issue, and it's not just a child health or nutrition or economic or environmental issue. It really cuts across. So I feel like there's a balance that needs to be found. Yes, we do need to ensure that we maintain a focus on maternal and reproductive health to ensure it's not lost. But we also need to work in coalition with others to amplify each other's voices and to advance a collective approach. And by working together, by bringing together a critical mass, you'll not only be able to get more attention to these issues, but with these multiple perspectives, you'll be better able to develop innovative solutions. And the work of Pathfinder, as Tabinda was referencing, is a great example of this kind of integrated approach. They certainly were one of the kind of early pioneers of population health environment, or PHE approach. So looking to organizations like them and what they've learned is a great way to go. And then a second is to focus on the opportunities and the benefits of action. A lot of news about climate change seems to focus on the doom and gloom. And there's often a perception that addressing the impacts of climate change will be difficult and costly. But many of the actions that should be taken now have immediate as well as long-term benefits. For example, reducing air pollution is a key way to mitigate climate change. But improving air quality also has important health benefits, both immediate, near-term, and long-term, and on population scales. We know that exposure to certain pollutants results in negative maternal and newborn outcomes and can lead to negative impacts across the lifespan of those exposed in utero and in early childhood. And those health benefits are in addition to the environment, economic growth, agriculture, and even education. And focusing on the benefits and the many different groups that stand to benefit can really help policymakers see this issue in a different light. So and especially when you combine those two approaches, looking at the potential co-benefits and working in coalitions, I think that can really strengthen the way that individuals and groups can approach policymakers at multiple levels.
This is incredible, terrific, absolutely. Thank you so much, Elizabeth. This is just like really right on point. So, I have so much to say about this, and I am looking at the watch, with eagerness and trying to stay quiet because I want to respond so much about all these issues. But the gist of everything you say, it's exactly how, one of the main takeaways that we want to have our participants leave with about the nature, the complexities, but also the opportunities, the many opportunities that we have and how we can make this happen. That as much as things are at a juncture that we may feel, we're not being heard, the opportunities are really, truly incredible. So I wanted to let me try to see if we can get this done, and so that I can have some time to do some Q&A and also be able to wrap this up on time. Hopefully people be able to stick around for a few more minutes, because this has been one of the most engaging conversations I've been in for so long. So now I just have Tabinda, following Elizabeth's point about the importance of engaging at the local, state, national level. The pandemic highlighted also the need for a stronger and more inclusive health emergency preparedness and response, resilient infrastructure, especially investments and considerations for technological responses to crises. How can we collectively work to meet MNCH needs, responses to crises? How can we collectively work to meet MNCH needs across all sectors, in terms of governance, financing?
Thank you so much, Annie. I'm not sure if I can add anything more to what Elizabeth and Angela have already said, but I think very quickly, in a nutshell, this is the time to work together. Multi-sectoral programming has been talked about for decades, but I think this is now the time to do it. One of the examples that does come to my mind is the Gender-Based Violence Multi-Sectoral Coordination Committee that has been set up in Pakistan with the support of Pathfinder, and that is an example that can also be used for MNCH programming, and this means getting the ministries together as well. It's not just us, the CSOs from different sectors that need to talk to each other. It's the government departments who often work in silos that need to talk to each other. And yes, coalition building, women leadership development, and bridging the gap between the communities and the health systems is going to be the key as we go forward. Thank you.
That's perfect. I have one last question before we turn it into the Q&A, but because we really want to hear, from all of you there, I am going to skip that question at the end, If I can be endorsed for more time, I'll go to that. But we know that we've had a very active audience, and so why don't I just do that and be able to ask this question. So first question is a question for Tabinda, and this is coming from Milena Bien Kuhl, and I'm so sorry that I didn't get to ask how the name is pronounced. So my apologies if I'm disrespecting the name that your name as I pronounce it. What exactly do you put in the green clinics you mentioned to make them sustainable?
Thank you so much. So this is a concept that is developing in Egypt, and we want to make our health services as eco-friendly so that the practices that the health systems themselves adopt, as well as in the clinics, are health-friendly, do not damage the climate as much as we usually do. This also has to do with use of energy. This has to do with the use and procurement of equipment and commodities that are that do not damage climate. In addition to that, the green clinics are attached to a wing of community health workers who, when engaged with the communities, not just talk about the essential aspect of reproductive health and the commodities that they need, but also the effect of climate change on the women and how they can prepare, how they can focus on resources themselves to combat the impact of climate change, which could be around food insecurity, access to safe water, etc., etc. In addition to that, I just also wanted to add here that I saw a comment in the chat box about the effect of heat on maternal health. And, research is showing us that maternal exposure to heat is associated with an increased risk of preterm and early term birth, low and decreased birth weight, stillbirth, etc. In addition to that, hypertensive crises related to strokes, also are something which make pregnant mothers more vulnerable. Thank you so much.
And if there's a need for that, I did add it some in my introductory remarks, some stats and information about all those the effect of direct heat stress and extreme weather events. And I'm happy to, with whoever is interested in wanting to get some of those talking points, or also coordinate or reach out to one of the speakers directly through our colleagues who are putting together this event. That's something that we will be happy to do, and I'm happy to share anything that I've ever said. So with that, I have this question for Elizabeth from Shamita Masilami about Elizabeth's outline of Prepared, that it aims to inform on early warning systems. I'm curious about how we can get communities receiving these warnings to act on them.
Sure, that's an excellent question. And it does get a bit complicated because there are so many different players and steps involved. And it ranges from getting the data, often from satellites that we have, the Earth observations systems and software, and then working with the meteorological ministries to accept, to interpret and receive that data, and then working with health officials to translate that into what does that mean for early warning systems for health. It's a bit different when you shift to the extreme weather events and disaster preparedness. Then you're speaking about evacuation routes, as well as centers that people can go, safety shelter centers, and making sure that the health systems are prepared for the impacts of weather. But with something like heat, you need to really work with health specialists who can help determine what temperature really requires or necessitates a warning. And then once that warning is initiated or the alert is sounded, what happens then? If people don't know what to do, if they aren't receiving the messages by radio or the public health department, they won't know what actions to take. And if they're not linked with, if those systems aren't linked with our health systems, and our healthcare practitioners aren't aware of the impacts that it have on the people they work with, or on advice that they could give, then they won't know how to properly respond. So it really requires making those multiple links all the way down. Someone mentioned the importance of community health workers. That is critical. They are, on the first line, on the front. So they're able to deliver some of the critical social and behavior change messages, for example, that we might want to do at those times. So there's a lot of work to make sure that all of those links are strong.
Thank you, Elizabeth. I mean, there's so much that I'd like to respond to, but I know that I'm looking at the watch and I wanted to just close in time. We're probably going to go 5 minutes over. I hope people can indulge us and stay around for this, extra 5 minutes. And so I have a question for Angela from Warren Nell. And again, apologies for my mispronunciation of anybody's names. What I wonder, are there conversations around how the health sector is contributing to, thus can reduce or slow down climate change? So the reverse relationship, they put in parentheses. What are the environmental impacts the health sectors has that are accelerating climate change issues, which we could address in our work? Angela, over to you for that question.
Thank you. That's a good question. I think everyone, including the health sector, is contributing to climate change. And if I'm going to talk about from my times of practice, I think disposal of wastes and how do we dispose that waste and how we follow through to ensure that that waste is well disposed. At the end of the day, there's a contribution, a negative contribution. I've been to different countries and I've seen the way waste is, and I'm talking about all forms of waste, whether in the health facilities, whether it is the drug company, I mean, so many of that. And the health sector is broader than just these health facilities. It's as Elizabeth said earlier, that it's broader than just health. There's so much more and there's so much linkages. And so how we dispose, how we burn, where we throw these things, what we do to all that, and how does that really come back to us? Because believe you me, whatever we do to the environment comes back to us in one way or the other. And that's why we are here today. And as such, I think everybody has a role to play to avert the issues around climate. And so the health sector needs to rethink, to sit back, to have a conversation with their communities, with others, with players who are affected, to really ask themselves and introspect and ask. That is one thing that we fear a lot, introspection. How are we contributing positively or negatively to this? And how can we work with the people who are affected to actually end this? Until everybody can be able to take their space, to take their role in this space, we will continue saying that somebody else is supposed to do this. We all have a role and a stake to play to avert the climate crisis. Thank you.
And that is just such an incredible segue for just finalizing this. As I'm just going to say something real quickly, since we're at time, and I can't even find the words, and that's kind of rare for me. I've been so inspired and excited and just eager to work with all of you and all of everyone who's been able to participate, and even those who were not able to. I feel like this is like the beginning of a conversation that's urgent to have. But the points that have been raised in this conversation have been so incredibly salient, to the point, and cover the entire gamut of really critical issues. It's coming from the people who are actually doing the work on the ground and who are seeing firsthand what we need to do. How can we join forces? What are the needs, and when and why we need to act now? And so with that, I'll just mention a few final points and bring this to a close, since I know I'm like about 2 minutes, past the time. So here's my attempt. I'm trying to do this. We cannot attempt to address climate change or use the term climate choice, might make so that we can look at it as a way of making better choices, something I heard somewhere and it kind of stuck with me. So we cannot attempt to address climate change without considering its impact on maternal health, which is the foundation of all health and of a healthy economy too. The backbone of a strong and resilient society and country. Governments must commit and ensure that the risk to maternal death maternal health and the needs of this population are included in their assessments of the climate crises and in creating climate adaptation plans. Climate-related disasters do not just affect one sector. As such, cross-sector collaboration, coordination, and in a broad multi-sectoral approach to work on tackling these issues and to improve overall resilience of societies is of utmost importance. Experts in maternal health and climate must have a seat at the table to ensure those who are pregnant have services to protect them. Focus on the people. Climate change is not an abstract and distinct issue. It affects us all, either directly and indirectly, and also immediately. We must find this sense of urgency to tell leaders what to do. It is not an option. What you can tolerate, you cannot change. And in closing, I'd like to thank our standing panel for their time, their work, for their contributions to this critical discussion. I'm in awe at everyone who's been part of this session. And thanks to each and all of you for your interest, your questions, and for your advocacy on behalf of mothers and children to ensure that maternal health is prioritized in all efforts to tackle impact of climate change. And on a personal note, my thanks to Ilaria Arancoy and Claire Lorenzetti for putting this event together. Without them, we couldn't have made this possible. With that, I'll bring this to a close, maybe a few minutes later, but it was all for the right reasons. And I am so grateful to be in your presence. Thank you for your contributions. Thanks for your work. And you'll be hearing back from us about the work that we need to do moving forward very fast. We have no time to waste. Every second means another life lost, and we have no time to do that. We have to act now. Thank you, everybody, for joining us and for your work and for being part of this important discussion. Thank you. Thanks, everybody. Thank you.
Thank you. Bye, everyone.
Thank you, everybody.